Hello, everyone, and welcome to CE Institute. My name is Selena Belisle, and I'm the founder and one of the instructors here who teach prenatal massage. We usually teach paid CE certificate and CE credit courses for the massage, body worker, and cosmetology industries for license renewal. But we also have many nurses, PTs, OTs, acupuncturists, and so forth in our classes. Everyone's welcome, and we hope to see you in a training. Today, we're going to talk to you about prenatal massage with heartburn or acid reflux, which is a fairly common problem, especially towards the latter months of pregnancy, and how you might address this, especially in your table positioning and bolstering of a prenatal client. Most of us have massage tables that have legs in the front and the back, and you can unscrew and screw on these knobs to raise and lower the table. One of the things that we're going to recommend with prenatal massage, those who are experiencing acid reflux or heartburn, we want you to lower the rear end of the table legs to be a peg or two lower than the top of the table where your client's head is. And this is going to help prevent the backflow of the stomach contents into the esophagus, which is what acid reflux and heartburn is. And if you have your table on kind of like a downgraded angle, some electric tables, you'll be able to electrically adjust as well, where one end of the table is higher than the other. That will help prevent the uncomfortable feeling. It's a physical prevention, not a pharmacological intervention. This physical incline of the table will help prevent that backflow in the esophagus. Now, there is pros and cons of having your table on an angle. Why don't we do this for everybody if, who has acid reflux or heartburn, or pregnant women with this condition? The reason why we don't do it for everyone is with pregnant women, they have up to 50% more blood volume and product within their body by the 9th month of pregnancy, right? And that usually contributes to swelling, especially in the lower extremities. So when you do have that table on that incline or declined angle, unfortunately, that's going to inhibit some of the venous return in the legs. So you're not really doing the legs a favor by having them on that angle. So with that angle, where the head is higher than the legs, if you do prefer to adjust that, you might be addressing the acid reflux and heartburn, but it might worsen the swelling in the legs, or it's certainly not going to help it. And you need to give your client that choice. If they're like, oh, my heart burns so bad, I can't even lay down. Well, we can adjust this where you're on an angle and you're not, when you're on your side lying, you're not lying straight flat. We can still have you on a little bit of an angle, just like in the semi-recumbent position. But give your clients that choice and explain to them, this is not going to help any swelling of your legs. And usually your prenatal clients are going to want to have that massage in the inclined position rather than on side lying as well, rather than forego and cancel their massage appointment altogether. You don't need to cancel. You can adjust by creating that incline. And just so you know, why does acid reflux and heartburn occur often in pregnancy? We think it's because of the relaxin hormone. And this is one of the scientifically shared theories, that this relaxin hormone that allows the pubic symphysis to expand and a lot of the ligaments and soft tissue of the body to expand and prepare for pregnancy and delivering. Well, that same relaxin hormone affects all soft tissue in the body, especially in the esophagus. There's a sphincter valve there that it relaxes and allows that backflow of stomach contents to happen a little bit more easily. And unfortunately, while you want that relaxin hormone to prepare the body for birth, unfortunately, it can have consequential effects such as acid reflux, heartburn, and even muscular joint pain and so forth, as muscles and joints move out of their normal range and find a new direction so that they can just prepare and deliver childbirth. So we hope this helps figure out how you might position your client who's suffering from acid reflux or heartburn, whether they're pregnant or not, especially when they're in the sideline position. You can have their head a little bit higher on the table and their legs a little bit lower. If you don't have, if you have an electric table that doesn't allow you to put the lower end of the table a couple pegs lower, you can always use pillows in the sideline position as well, to put some pillows underneath the torso, not just the head, to raise the esophagus above the stomach and hopefully prevent that backflow. Keep in mind, as the fetus grows larger and larger in your pregnant clients, the growth is usually upwards and outwards. So in addition to the relaxin hormone, you also have this physical, the placenta itself pushing up on the stomach, pushing the stomach pushing the stomach itself and the contents of it further into the esophagus. So it's really important to address this for clients to make them comfortable. We don't want them canceling just because they don't feel comfortable lying down anymore and they're practically sleeping in chairs and other things. Okay, so I hope that helps. There are many prenatal massage contraindications, service precautions, and tricks of the trade that you can do to make your pregnant women more comfortable during prenatal bodywork and massage. We teach those all here at CE Institute in our prenatal training, and we'd love to see you in a class. So if you want to register with us, we're at ceinstitute.com. That's CE as in continuing education, ceinstitute.com. And until we see you in class, be safe.